I think I've lost count, but I think it's about 21st symposium that we've had since we started the first one. And my good friend then Erling Falk and P.K. Shaw and my late mentor, Dr. Ward Cassels, were with me when we started the first one. It was 2001, March at ACC. We have come a long way. And that one was focused only on vulnerable plaque, and Dr. Fuster gave an opening talk. Vulnerable plaque was hot and a focus of our attention until we were, our eyes were open to a broader scope of risk by non-invasive imaging. And that, to a great deal, is owed to pioneers such as Matt Budoff, John Rumberger, Dan Berman, Raymond Herbal, and many others that I can't remember everybody's name, but Harvey Heck, yeah, he was the infamous blamed and attacked and so many, and survived. So non-invasive imaging came, and Dr. Fuster was on the forefront presenting so many innovative technologies. Out of many, carotid plaque imaging by ultrasound and coronary calcium got the SHAPE Task Force attention in 2005, thanks to many studies that build the ground for this pioneering concept. So the concept, it is so amazing 2013 to pay attention to it, because this was 2004 or 5, and when we started this SHAPE Task Force meeting, in particular, a smaller group went to Santa Marina, or Marina del Rey in Los Angeles, thanks to Dan Berman and P.K. Shaw, closed the door and came up with this approach, that in order to identify risk, we better to focus on risk assessment rather than risk factors. And to assess risk, we have two paths, a structural path and functional path. And the latter, functional, was for the most part owed to our friend Jay Cohn, who was presenting the endothelial function. Unfortunately, we've had very little data comparing to the structural path on that, but these two were contrasted to the risk factor component part. So the SHAPE Task Force, again, we're talking 7 years ago, 2006 published this, but 2005 developed it, that you need to start with assessment of risk, not risk factors, assessment of risk by looking at the disease itself. An atherosclerosis test at that time was defined as coronary calcium and carotid IMT and plaque. I emphasize on the plaque part. And so if you're negative, your approach should be different than if you're positive. And if you're positive, regardless of your normal LDL and normal cholesterol, you need to get treated. This message, it is amazing that after 7 years we're hearing that some people have started to waken up to it. So the SHAPE guideline went to further break it down by categories. Here's where we got stuck. Basically, we were asked for a very difficult task to accomplish, and that is go bring me a clinical trial, an outcome study of thousands of patients who were asymptomatic and were categorized based on SHAPE, and you showed that you reduced mortality, improved outcome. This, we knew that. As an academic researcher, we know that you need to have this kind of outcome data. But how do you get there? We tried to lobby the NIH to fund such a study. It's a very expensive study. We couldn't get it. This was 2006. I actually chaired a symposium, invited the NIH colleagues. Didn't work out. Dan Behrman guided me to a famous philanthropic source, and we tried to ask him to cough out $100 million for this study. Unfortunately, he got distracted and gave that money to Newt Gingrich, and we didn't get it. But the evidence was there. The evidence of risk assessment was there. It's the intervention that they're asking us. And we really, SHAPE doesn't have any particular method of lowering risk, not yet, in terms of a new compound, a new drug, but we were out to raise awareness on the importance of assessing risk and focusing on disease, not risk factors. So I assume everyone knows that the new guidelines, I call it literally broke down the wall of LDL. That focus that they've had for years on risk factors in LDL is no longer in place. I just, while we were waiting, heard from Jay that he is aiming at breaking down the wall of blood pressure. These two are the most frequently referenced and focused on risk factors, and SHAPE is about going beyond risk factors. With that introduction and a little bit of reminder, I'd like to welcome everyone to a series of amazing talks that are coming your way. Dr. P.K. Shah, our friend, unfortunately ran into an unforeseen thing and had to bail out, but he did send his esteemed colleague here who is going to share with us. This 10-minute that is coming to you is outside of the immediate focus of SHAPE, but it is the goal of SHAPE, and that is eradicating heart attack. And in the history of mankind, nothing has worked for eradication better than vaccine and vaccination. And PK has been behind this. I have a little complaint to tell him that, please tell him that he told me 10 years ago that we will have a vaccine in 10 years. We're not there yet, but he did not give up, so neither his friends and his team. So the first 10 minutes here, you're going to hear about the latest on development of vaccination strategies for prevention of atherosclerosis and treatment of atherosclerotic disease. I'd like to stop here, and I want to credit some of these guys who helped with the actual write-up of the SHAPE task force. The SHAPE task force is a large group, and most of them are accredited on our website, but these are the Hollywood stars of the SHAPE task force and got the camera. So Dan Behrman over here, Matt Budoff on there, Erling Falk, John Rumberger, Zahi Faya. I haven't seen him for a long time, but he is under Dr. Fuster. I'm sure he's behaving well and doing the SHAPE duties, and Harvey Heck.